If your hip has been slowing you down, keeping you from walks, sleep, or the things you love, you may be dealing with hip arthritis. My name is Dr. Palumbo, and in the next few minutes, I want to walk you through exactly what that means and how we treat it. And if surgery becomes the right answer, how the direct anterior approach can get you back on your feet faster than you might expect. Hip osteoarthritis happens when the cartilage cushioning the ball and socket of your hip wears away. On X-ray, we see the joint space narrow, bone spurs form, and the femoral head lose its smooth, round shape. Patients typically feel a deep groin ache, stiffness in the morning, and pain that worsens with walking or stairs. Before we ever talk about surgery, we exhaust conservative options. Weight management, anti-inflammatory medications, and physical therapy are our first line. In therapy, we focus on hip flexor, flexibility, and abductor strengthening. Strong abductors reduce the forces across the hip with every step. When pain limits therapy, an ultrasound-guided intra-articular corticosteroid injection can provide meaningful temporary relief. Using real-time ultrasound, we guide a needle precisely into the hip joint to reduce inflammation and delay the need for surgery. When non-operative care no longer controls your pain, total hip replacement becomes the conversation. Before proceeding, we carefully evaluate your medical readiness. Conditions like uncontrolled diabetes, obesity, and cardiac disease all increase risk. Optimizing these factors before your procedure meaningfully improves your outcome and reduces the chance of complications. The direct anterior approach is a muscle-sparing technique. Unlike traditional surgery, we don't cut through the gluteal muscles. We access the joint through a natural interval between the muscles at the front of the thigh. No muscles are detached from bone. We prepare the socket and implant a Enovis acetabular cup secured with precision into the native bone. On the femoral side, we prepare the canal and seat a Enovis femoral stem, ensuring a perfect fit. The geometry of the reconstruction is verified with fluoroscopic imaging on the table, giving us crucial real-time feedback. Because we haven't detached any muscles, most patients are walking the same day as surgery with no hip precautions. Most patients go home the same day. Physical therapy begins immediately. Most patients are driving within 4 weeks and back to low-impact sports within 2 months. We use a ceramic femoral head paired with vitamin E-infused polyethylene, a liner engineered to resist wear at the molecular level. Vitamin E preserves the integrity of the poly over decades. Long-term studies show greater than 95% implant survival at 20 years. If hip arthritis is holding you back, you have options. And the direct anterior approach offers a faster, safer recovery. I'd love to talk with you about your hip. Give us a call and let's get you moving again.